I have been working as an LPN for 40 years now. 39 of those years I worked at the Tripp Good Samaritan Society. It had for assisted living, and it was Medicare, Medicaid certified facility at long-term care.
I was born and raised in Tripp and went to school there, and my first job was at the Tripp Good Samaritan Center. When it was originally built, it had 65 beds, which was a significant impact in the community. There's, I'd say anywhere from 60, maybe at certain points 70 people that worked there.
Mona Hoff and Cindy Batterman are both former employees of the Evangelical Lutheran Good Samaritan Society nursing home facility in Tripp, South Dakota. When it closed its doors in March of 2018, it meant the loss of the town's biggest employer, displacing all of the facility's residents and those who worked there.
We never had any notice. They came down, a team of employees from central office, and told us that the facility would be closing.
I think a lot of things we saw were budget related too.
Yeah.
And financially, you know, there weren't, as an employee, no raises, maybe supplies or equipment that we would have maybe liked to had, or even general, you know, functioning ability was becoming more difficult all the time.
Just 17 miles down the road in Parkston is Avera St. Benedict Health Center. It is a fully integrated rural health facility with a hospital, long-term care options that include a nursing home and assisted living center, plus a rural health clinic. Rita Blasius, the president and CEO of Avera St. Benedict, understands the struggles that so many long-term care facilities are facing. Fortunately, hers is not one of them. When it was discovered that the Tripp Nursing Home would be closing its doors, Rita and her staff knew right away they needed to be ready to help residents looking for a new home and possibly employees looking for work.
We began to hear right away the day that the announcement was made from both employees of the Tripp Good Sam and from family members who had residents in the nursing home. Family members of residents were frantically trying to figure out where they were going to go with their family members. Our providers, our physician and mid-level provider that served the Tripp Nursing Home and the community of Tripp, were their primary care providers. So that was a big concern, and we started to hear from them on the nursing home side for placement because they did want to be close to their doctor. We also began to get phone calls from employees who were beginning to figure out that they were going to have to find you know, a new job.
And I know some of them had a very difficult time finding placement for their family members because of either their physical care that they needed may be specific, or their mental status was specific, and certain places specialize in different areas. So finding the right fit for that person, or finding the demographics that work for your family.
They actually did all find placement. If it was where they wanted to be, I don't think so. Some of them were not where they really wanted to be, but again, it was very devastating for the families. This is their home. They were taken out of their original home, and now again another home.
We had people who called, who stopped in. We didn't have anything available at the time, but we, like always, we put people's names on the waiting list and obviously assured them that as soon as we had an opening that we would be reaching out to them.
Mona and Cindy were both able to find employment through Avera St. Benedict in Parkston. But they know, as do many others in the healthcare industry, that moving staff and residents from one facility to another due to closures is a Band-Aid approach to a much bigger problem.
We are very appreciative of the attention that our state is giving to this long-term care issue from a reimbursement perspective. This isn't a new problem. It's been ongoing for a long time. We simply currently aren't being reimbursed what it costs us to take care of a nursing home resident in the state of South Dakota. And part of the cost then impacts our ability to recruit and retain employees. We have lots of competition out there, and in long-term care, our hands-on caregivers work 24/7, 365, every day and every night. So we need to be very competitive with our salaries and wages. The unemployment rate in the state of South Dakota right now, I mean, doesn't encourage folks to come to jobs that require 24/7, 365 shifts. But we really need to go back and focus on the actual payment reform issues that need to take place, I think. Those are hard discussions, but that's where we need to go.
Well, I think it was a special situation because we were one of the first to close. I think now, after a year later, the ripple effect is out there, and people are wondering, will we be next? Everyone is interested in economical development, and for these small communities and the number of jobs that it provides and the impact it has on our communities, it is vital. Mm-hmm. You know, it serves as it's a main vein, at least in our community it was. Mm-hmm. And it's affected so many things that we didn't think about at first. Like Tripp does not have a hospital, so we had our nursing home, but it was also our adult day. It is vital. It's vital for our state, it's vital for our communities and our most vulnerable members of society.
I'm just grateful that I'm hearing a lot more on the news now that they are addressing this, that they are seeing that before there is any further closures in the state. I'm very grateful that they have awakened to this crisis that we're going through right now. Good.